let's just give you the big picture. When it comes to our fight against the spread of the coronavirus, India has added 42,766 new COVID cases in the last 24 hours. That's slightly lower than yesterday's 43,393, I beg your pardon, cases. And Kerala now leads the states with the most number of cases in a day. Kerala, with 13,563 fresh COVID cases, leads the states in the most number of infections over a 24-hour period. It's followed by Maharashtra, way back at about 8,000, Tamil Nadu at around 3,000, Karnataka at around 2,000. And I spoke earlier to the person at the helm of the state's fight against the spread of the coronavirus, Kerala's Health Minister. Here's our chat. Thank you for your time, ma'am. We know you're extremely busy. Kerala has a large vaccine footprint. Yet at the same time, infections in Kerala are rising, adding to India's overall COVID caseload. Now reports that Kerala accounts for 30% of India's daily COVID tally. How do you explain this paradox, ma'am?
We are going through the second wave of the pandemic, and we had our peak on May 12th. And the second wave started in our state on by the middle of April. And on May 12th, we had the maximum number of positive cases on a single day, and that was around 43,500. And then it went on decreasing, and now it's around 10,000. And now we are having a plateau, and it is quite expected in our strategy of defeating or in facing the COVID, because we have developed such a strategy that we have always tried to keep the number of cases beyond, that is below the medical capacity threshold. So as you all know, in Kerala, we didn't have a case where any of the patients, he or she died without getting oxygen or without getting ICU beds or without getting ventilators or anything. So our strategy was always to keep the number of patients below the healthcare capacity threshold. So we are going on like that. So this plateauing of the wave is quite expected in this phase of the second wave, and we are trying our best to decrease the TPR and also the number of positive cases.
So this is all part of the plan. This is what was expected. This is a plateau, not a peak. You're absolutely right, ma'am. Kerala stood out as one of those states where you weren't hearing those horrific reports of people dying outside hospitals without a bed, without oxygen. And certainly the overall death toll due to COVID was amongst the lowest in the state of Kerala. But how do you explain, ma'am, the continuing high positivity rate right now? We're finding Kerala reporting almost 13 infections per 100 tests. States like UP, for example, somehow this figure is under 3, I think.
Yeah, our test positivity rate is around 10, and today it's the 3 days average is 10.5%. Okay. And what we do is that if a person is found positive, we do the tracing like that. That is, we find his primary contacts, the secondary contacts, and the tertiary contacts, and we conduct tests. So what we do is we do the targeted test, not random testing, we do targeted test. So out of the 50 people who are in the contact of the first person, there is possibility that more persons will be positive. So we are ensuring that no one who is positive, who is infected from the first person is going without getting reported. So in Kerala, we ensure that also the seroprevalence study we have conducted earlier, it shows that only 11% of the total population was infected, and also we report 1 case out of 3. That's if 3 persons are positive, 1 is definitely reported. So that is our strategy. That is also a part of our plan. So we are focusing on targeted tests. So we believe that that will help reducing the spread of the virus.
So if you do targeted testing as opposed to random testing, this is only to be expected? is what you're saying. There is also a concern across India about the fact that our vaccination rates are now starting to fall. In fact, we've seen a huge fall between yesterday's vaccination numbers and today's 10 lakh difference between the two. Where does Kerala stand in terms of vaccinations? Do you have enough supply, and is it enough? The rate of vaccinations in Kerala, is that enough to stave off a third wave?
So in Kerala, we have more susceptible persons. As I said just now, the seroprevalence study shows that only 11%, now it might have increased to some 20% or 21%. And again, still then the number of susceptible persons in Kerala is very high when we compare it to the other parts of the country.
Yes.
So the only way before us is to vaccinate our people. We have developed a very good system in our state to vaccinate the people, and daily we can vaccinate more than 2.5 lakhs people, and some days we have went up to 3 lakhs vaccinations a day. But we have put our request before the central government to give us more vaccine. Our request is to give us vaccine according to the percentage of the susceptible persons and not according to the percentage of population. So we have written letters to the Health Ministry, and also...
What is the response you've gotten, ma'am?
Sorry?
What is the response you've gotten? Because you're making a very important point here. You're saying the state of Kerala has a higher percentage of more vulnerable persons to the coronavirus, and hence you believe that Kerala should perhaps be given more of a priority, or at least the supply to Kerala of vaccines should flow freely.
Yeah, definitely, because we have zero wastage of vaccine, and also we have negative wastage of vaccine. If we can vaccinate from one vial, if we can vaccinate 10 persons in Kerala without any loss, we are doing it in 11 persons. We are vaccinating 11 persons. So our request is to give us more vaccine according to the number of our susceptible persons, and we are looking forward, and we hope that they will consider our request.
Have you heard back from the center? Any response to your request?
We are looking forward, and we have asked the central government to give us more vaccine, and anyway we are looking forward. Hopefully they will be providing us more vaccine.
All right. Ma'am, though you know, the Prime Minister has voiced concern at the persistently high number of coronavirus cases coming from the states of Maharashtra and Kerala. Meanwhile, this week we've seen signs of life limping back to normalcy. Kerala eased up on restrictions this week on Thursday. The Transport Minister has said that the KSRTC is ready to start interstate services. Across the country, we're seeing visuals of Indians thronging, going to tourist sites, etc. Is this not a concern for you? Are these cases similarly in Kerala also not high or increasing because of the opening up?
See, this was the case in the first wave also, because while in other parts of the state, when they were unlocked from the first wave by September 2020, we were having our cases in the first wave in October, November, December, January, etc. So we slowly started, and we tracked the wave. We tried to track the wave, and so in our state, we have many other challenges. The senior citizen population the percentage is very high, and also the number of diabetes patients is very high in our state. And also one more thing is there, it's the population density. And as you know, it's double that of the national average. So these were the challenges when we developed our system, and these are the challenges now we are facing. So we are trying to drag the curve. We try to delay the peak, and now we are trying to drag the curve.
All right. And ma'am, the key factor that epidemiologists track and that has everyone worried is the R factor, right? At 0.92. What is the R factor in Kerala? Is it not above that danger mark of 1.0?
No, in some districts it's around 1.12 or something, but we are closely monitoring. And another variant, Delta Plus, was found in 3 places in 2 districts. And so we are closely monitoring, and we are categorizing the local bodies according to the TPR, like now it's 5, 10, 15, 20, etc. So those local bodies which are having a TPR about 20, we enforce triple lockdown in those local bodies, and in from 15 to 20 it's lockdown, and like that. So we are enforcing strict restrictions, and also people in our state, they are cooperating with all these measures, and they are wearing the mask, and they are trying to obey or observe all these decisions taken by the state.
Ma'am, I would attest to that. I traveled to Kerala, I think 2 months ago, and I was completely surprised with the operation underway at the airport, the systems in place. It really was amazing. But of course, leadership is tested, in a time, truly tested in a time of a crisis. And right now, Kerala is battling a war on 2 fronts. You also have the coronavirus fight. And in the midst of this, now hearing reports of Zika, and the center has sent a 6-member team to monitor the Zika virus situation in your state.
Yes, thank you for your good words. And about Zika, the first case was reported in a 24-year-old woman, and she was pregnant. She came to the city for her delivery, and she delivered a baby, and both the mother and baby, they are keeping good. And 19 more samples were sent to NIT Pune, and out of those 19 samples, 13 were found positive. And again, we sent 14 samples, and all those 14 samples were found negative. So now everything is under control. We have intensified the vector control activities, and also with the coordination of all the departments and the district administrations. And we are focusing on surveillance of pregnant women. As you know, if the Zika virus or the Zika virus disease, it may cause some defects to the babies, and so we are focusing on surveillance of pregnant women, and we have asked all our medical officers to do tests for Zika in all pregnant women who have fever or Zika-like symptoms.
Veena George, the person in the hot seat in Kerala, thank you for your time and clarifying all of that. Thank you.